So welcome to the We'll Keep It Short podcast. We're your hosts. I'm Dayna Ukwuoma. I'm a board-certified pediatrician working in my second year as an attending.
And my name's Diane Ukwuoma. I'm an adult and child psychiatrist.
And the purpose of our podcast is basically just to debunk medical myths, share our medical expertise, and just give our personal insight into our own medical journeys.
Yep.
Today we have a special guest with us. This is Dr. Donika Hasanaj. Donika completed her residency at Tennessee State University. Now she's currently a second-year fellow at Johns Hopkins University, where she's training in child and adolescent psychiatry. So welcome, Donika.
Welcome.
So happy to be here.
Really happy to have you. And just tell us a little bit, like, how's your second year going?
It's going really well. First year was pretty tough because a lot of inpatient and consults and long days were part of like my training, but outpatient has been a little bit more laid back. There's some more free time during the week, so it's been a nice transition.
Good. Yeah. I'm so glad to hear that.
And you'll be graduating next year, so can you tell us a little bit about what you're looking into, inpatient versus outpatient? What do you think?
Yeah, I'm really excited because I just made the decision to move to Chicago for next year.
Congratulations.
Thank you. I'm really excited. So yeah, I'm thinking about doing an outpatient job for right now. If there's no opportunities out in Chicago for that, then I'm willing to be flexible and do inpatient.
Yeah.
I would really love to work with trainees, like residents and fellows. I feel like that would be a fun experience. I've always been really dedicated to teaching and passing down my knowledge, to those also in the field. So either way would be fine. But yeah, I'm looking towards outpatient. I want to work with kids with autism and catatonia and potentially do like interventional neuromodulation techniques like ECT and TMS. So we'll see.
Hopkins is the perfect place to train for that. And for anyone who doesn't know, me and Donika were actually in training together. So that's how we connected. Yes.
Yeah, we were in different classes. We got close.
Yeah. All right.
So we're really happy to have you. And the topic today is pertains to anybody in medicine, right? So we're going to be talking about burnout, imposter syndrome, both very important topics. I think I want to get a little bit into burnout and that topic and just explore that a little bit. I know the culture around medicine right now is work. We're providers before anything else, but sometimes that can definitely take a toll on you. So, Donika, if I can ask you first, like around the concept of burnout, how does that affect you or has it affected you so far in your training?
Yeah. No, that's a big thing that I think a lot of people do struggle with and don't really talk about much. But I actually started experiencing burnout when I was in medical school. So pretty early on, like before I was like in residency or fellowship. And I remember calling my mom in second year of medical school, just like crying. I'm just like, this is so overwhelming. There's a lot of pressure and I don't think I can do this anymore. And moms are always very supportive and she's like, whatever you want to do, if you need to drop out, I'm here to support you. And then I go and tell my dad the news and he's like, nope, no tears in medicine.
Because your dad's a physician.
My dad's a physician and he was like, get it together. Like, it's going to be okay. You have to push through this. And it was kind of hard for him to understand. He did his training and residency and all of that back in Europe. So he went through a lot more struggles than I did. He had to learn like a second language, like Serbian, and he was there like during the war a lot of the time. So I think it was hard for him to understand like the stress that I was going through, and just like mental health in Europe is like not as talked about as much, especially in his family. So when I was sharing what I was going through was not very well received, but my mom was very supportive, and my sister is a big person in my life who's like my confidant. So I went to therapy and, did a lot of like exercise and self-care, and I actually told my medical school at one point, I'm like, I need some time off to myself to just like recuperate, to focus on research and not having to deal with an exam every other week, And that was probably the best decision that I made for myself at the time. And so, medical school was like the first hurdle that I had to encounter that.
I feel like
that breaks helped.
Yeah, I'm sorry. I feel like that statement you made, no tears in medicine, is really important.
Yeah.
Because the physicians were told that basically we have to suck it up. You have to show up every day at work. You don't show your patients when you're upset. You don't tell other people when you're upset as well.
Yeah.
It's like the culture around medicine, which can be really toxic.
Right.
But how did you know what was going on, like, that you knew you were going through burnout? You know what I mean? Was it the long hours? Was it that you felt like you couldn't talk to anybody about
Or did
issues?
you experience something like emotionally or physically or whatever the case is?
I think it was the intense pressure of performing all the time, the isolation of having to study every day for like 10 hours a day.
Right.
I was in the library all the time, and I think I hit like this is going to be pretty vulnerable. But, I was in like a deep depression during that time because I didn't really make time for a social life. And I was kind of in my apartment or in the library for most of my life in medical school.
Right, I know what that's like.
I know what it's like.
Yeah, and so I was just like, man, if this is going to be the rest of my life, this is not for me. You know what I mean? I like couldn't see past like studying all the time when you're in like the thick of it for medical school and having to pass all these exams, right? So, you have the pressure of also like your family wanting you to achieve, especially your father who's like expecting a lot from you, high expectations in the family. It's just like a cultural thing too for him. And so like, when I reached that point of burnout, I felt very disconnected from everyone. I didn't want to hang out even if people asked me to.
Like you feel guilty in a way.
You feel guilty. You feel like I have to study. I'm going to, not pass my next test and then I have to remediate, right? Which is make up for it. So that's more time, that I would have to spend on studying. So that really affected me, but I was able to get through it, but it was really tough. It was really tough.
And I feel like burnout and isolation kind of go hand in hand. Like when you isolate yourself from the problems that you're dealing with in medical school, like you said it perfectly. Like I used to go to the library every morning, stay there for hours per day, go home, sleep. It was such a routine where I wasn't reaching out to people around me. I felt alone, and you're right. You sink into your own emotions, which is pretty hard itself. But when did you know, or how did you know when it was time to reach out for help? Was it like you had a breaking point one day, or did you just feel like, I'm ready to talk about it? Because you said you went to therapy as well, too.
Right. I started opening up about it to some of my medical student friends at the time. Because this is when I was a medical student when I first experienced it. And one of them actually related to things I was sharing, the isolation, just low mood all the time, just cannot feel any type of happiness, and just self-doubt constantly. And she shared with me that she is seeing a psychologist. In the area, and also a primary care physician. I wasn't seeing either of those at the time, and she shared with me their contact information because she was just like, what you're going through is very real. A lot of people experience it more than you think.
And ignore it a lot of the time. Yeah.
And so I think she like kind of saved my life, to be honest. I saw the doctor that she recommended, the primary care doctor who dealt with medical students. I was at Wake Forest at the time, and he was amazing. And he really helped me out. I got connected with the psychologist. And I think just like opening up really helped. But I think I got to that point after, like it was in my second year of medical school. I probably waited too long to reach out for actual professional help. But it was just to a point where I felt like I was crying all the time. And I just felt like I was numb. And I was just going through the motions.
Right.
And that was like when I was like, I need to talk to someone and do something about it.
I think another thing that's interesting, and it's kind of in line with what you're saying, like a lot of people in medicine hesitate to get help.
Yeah.
And one of the things that I think isn't spoken about enough in medicine is like physician suicide, because people wait so long. I know when I was in residency, there was a lot of people, not a lot of people, I would say there's a handful of people who like, they have suicide attempts and they shut down, and they're like, no one knows what's going on until they reach out. So it's like an incredibly hard thing to do. Right. And you went into psychiatry. I went into psychiatry as well. Do experiences like that, do you feel like it pushed you towards psychiatry because you wanted to help people who were dealing with a similar like darkness during that time? Initially, I thought about drawing away because we see it so often. So like, how do you take care of yourself, like kind of hearing these stories again? Is it re-traumatizing for you, or?
Yeah. So I actually didn't want to do psychiatry until I did the rotation in my third year of medical school, because I really have never dealt with patients in psychiatric care. I didn't really know what it was like. I just didn't know much about it.
Yeah.
But when I did do it, I was like, wow, this is like refreshing, to actually talk about mental health, emotions, feelings, because it wasn't really big in my family to talk about that. Very strong European family background. Culturally just wasn't as, I don't know, wasn't a focus or whatever. So when I went through my clerkship, my psychiatric rotation, I was like, wow, this is something that speaks to me. Right.
Yeah,
I was like, these are the people that I want to help, because I've experienced, like you said, like a dark time in my life multiple times. Where I know how it feels to have that helpless feeling and need someone to talk to and reach out to. And I wanted to be that helping hand in a way. Yeah. So that was definitely part of it.
Yeah. And you're right. It's so hard because I feel like I don't want to call it shame, but there's a level of shame and guilt. Like, am I supposed to be feeling these things? And then you look around and you think everybody else is just doing it so well. Right. You're kind of just closing in by yourself. I know I definitely feel like that too. Like my own pediatrics residency was go, go, go all the time. And I feel like we were trauma bonding at one point. Like everyone was going through it. but no one was getting help or nobody was talking to other people.
Yeah.
It's just the name of the game, basically, too.
Yeah, and I feel like when you hear those stories, like when you hear your colleagues have gone through a dark time, like no one really stops to pause and like think about it. It's just like the name of the game, like you said. And that's a really dangerous thing in medicine because you never want to be so like it really does become an invisible illness. You know what I mean? Like you never see what people are going through. You can resonate, and it just teaches you to move on quickly. And I think that's dangerous.
Yeah.
So, but it's seen so often, right?
And it must be more interesting for you to as psychiatrist because you can identify some of the signs. You see what people are going through as well. And it's hard to self-diagnose, your own self and notice when you're going through that too.
Yeah.
Right. Maybe you can do it much more easily. You know what I mean? Like, I know what I'm going through right now. Should I get my own help or should I, keep going through it?
Yeah. And it's such a real thing. So I think that like many of us, like as psychiatrists or like even when I was a trainee, you sit across from someone who may be going through something that's very similar to what you're going through, but you're giving them the help and maybe you need that help yourself.
You need it yourself.
So it's like a balance, like every day I feel like, and it's worth it, but it can be hard when you're in that state,
For sure. That's so important too. But if there's one thing I could offer to someone that's going through burnout right now is don't let it sit with you either.
Yeah.
Something that you kind of want to address right away, but that's easier said than done. You know what I mean? I feel like when your body's wearing out, like you feel it. It starts with your body, then it goes to your mind. And that's the part when you have to like really reach out to a friend or someone to speak to a therapist like you said as well. And that's very helpful too.
Yeah. What do you do for like wellness? Like what do you do to keep your mind in check?
I first off hang out with Diane.
Yes.
Of course, Dana's always invited and she's usually there.
Thanks.
So when I was in residency, that was again another time when I experienced burnout and isolation. So I got me a dog. She's a corgi. Her name's Tilly. So I hang out with her all the time, and it actually gets me out of the house, gets me connected. So cliche with nature, and just like I walk like 3 times a day with her because I feel bad that she's in the house all day. Same.
Yeah.
I actually have joined like the local gyms here. It's called Merit. So I do that every day. I make it actually a purpose to work out every day. I know that sounds excessive, but at least 30 minutes where I'm moving.
Yeah, even if you're just walking, it's just to get out of the house.
It clears your mind.
For sure.
It really does clear your mind.
Oh yeah,
for sure.
Yeah, for sure.
And just like a simple conversation with my sister, family, or friend is always very helpful. I do that at least once with someone every night. And then this is kind of an odd hobby, but I crochet.
I didn't know that.
I do.
That's awesome.
Yeah. When I was younger, this like elderly lady in my neighborhood taught me how to do it, and I was like, I've never dropped this skill since. So I do that as well. It's just like something that just like shuts my mind off.
Yeah.
And just like carefree show. This summer I Turned Pretty was something I was watching recently, just for example.
Is that Netflix, right?
Yeah. Or Amazon Prime. I can't remember.
Okay.
But no, stuff like that like is the way I like recuperate.
Yeah.
And I know I talked about being alone in medicine, but now I'm like, I need my alone time because you're like go at work.
Yeah, exactly.
And you're hearing a lot of like tough stories from patients.
Yeah.
So my solitude is something that I also appreciate. Yeah.
But do you feel like it's a balance? Because I feel like too much alone time is also not good.
Oh, absolutely.
Right? Yeah.
Absolutely.
Yeah. Devil's playground.
Yeah. I make it a point to go out at least like twice a week with like people.
Me too. Exactly.
Yeah.
I have to speak to someone else, or else I'm just stuck in my apartment all day.
Yeah.
But I do think this was a wonderful conversation, like about burnout in general. And so now we're going to move to part 2. Welcome to the We'll Keep It Short podcast. We're your host. I'm Dayna Ukwuoma. I'm a pediatrician, currently working in my 2nd year as an attending.
And I'm Diane Ukwuoma, child and adult psychiatrist.
And the purpose of our podcast is mainly to debunk medical myths, share our medical expertise, and give our own personal insight into medicine. Today, we have a very special guest with us.
2 special guests.
2 special guests. I'm so sorry. So we have Dr. Donika Hasanaj. So Donika studied at East Tennessee State University, where she completed her residency in psychiatry. And now she's currently a 2nd-year fellow at Johns Hopkins University, where she's training in child and adolescent psychiatry. So welcome.
Thank you.
So you already shared with us before, but just again for part 2, what are you planning on doing afterwards? How are you enjoying your 2nd year?
Yeah. 2nd year is going well so far. Did a month of outpatient for 2nd year, and it's great. I think that's probably what I want to do when I move to Chicago. That's my plan for next year. So hoping I can find a job out there and fulfill that dream.
Amazing. For people who don't know, Diane and Donika did their fellowship together.
Yes, we did. So our second guest on the podcast is Dr. Sara Abdelhafiz. She completed her neurology residency at SUNY Upstate, the same institution as Dayna and I.
Yay.
And she's currently in fellowship at Georgetown University.
Thank you. It's been great. Like it's awesome. This is my first time doing a podcast, and I'm glad it's with you guys.
We're so happy to have you.
Thank you for having
How was
me.
fellowship in?
It's definitely a steep learning curve.
Yeah.
Like from being told what to do all the time and having
Yeah.
that kind of structure to doing things on your own, but it's still in a controlled setting. So it's definitely kind of like, a different experience.
It is.
Yeah.
I remember that.
Yeah.
Awesome.
All right. Well, the topic that we really want to get in today is something, again, very important in medicine, and that's imposter syndrome. Yeah. And basically, we just came up with this because Diane and I were just scrolling, trying to find things to talk about, honestly. But then we know this is huge. Okay. So many people think of imposter syndrome as I don't belong here. Okay. But other people say it's a thing, but I've never experienced it. And so we kind of got into this back and forth conversation. Is it real in medicine? Is it something that everyone goes through? We kind of want your opinion on that. So as far as imposter syndrome, is it inevitable in medicine? Is it something that everyone's going to experience once? Or is it something that you've never experienced before?
Yes, and you guys can be as honest as possible. Yeah, so why don't we start with you, Sara?
Sure. So I think in situations or situations where you're always being ranked and compared and evaluated, you start asking yourself, am I good enough? Can I be here? And not even, am I good enough intellectually? Do I even belong in this setting?
Exactly.
So it's definitely inevitable. I believe so in that field, in any environment that creates these kind of questions.
I agree with that. And it's also a thing like, I feel like we all know we deserve to be there. Like, of course, we passed all the examinations, we took the test, we deserve to be in the room we're in. But sometimes it's like, do other people think that as well? I don't know if that's just me who may feel like that. Like, you're good enough, but the idea of like what other people may visualize or think in their head kind of changes your attitude and the way you walk, and maybe gives you even performance anxiety in a way. Yeah. Do you guys think that too?
Yeah. Absolutely. I always thought I slipped through the cracks.
Tell us more.
No, for sure. I think that started, I did well in high school.
Yeah.
College was great. And then medical school, everyone's brilliant around you. And you're just like, wow, I am not the high achiever in the class anymore. You don't feel as smart. And I don't know, it gets to your head a little bit for sure. I don't think it's inevitable. Some people are very confident with, what they have, and they work through those feelings of self-doubt, but I clearly did not. And I definitely felt them. And I think, it helps when you talk to the, people above you, like your supervisors or your professors in medical school, your attendings when you're working with them at work, that, if they share, they've also felt that, it makes it more normal because a lot of people do.
Exactly.
But when you don't do as great as you want to on the exams, you experience burnout, like I said in medical school from before, and you're not doing as well as you want to, those thoughts definitely are very apparent.
They creep in.
Well, I think that's a really good point. I want to ask you both this question. Like, I feel like I dealt with imposter syndrome from beginning to end.
Yeah.
Like up until the last month of fellowship, I was probably still dealing with it, especially being at an institution like Hopkins.
Yeah.
I'm sure you may experience this at Georgetown as well, because it's such a big name school. Did it ever go away? And this is directed to both of you. Or did you find a way to get over it? Or did it stick with you?
Oh, no, go ahead.
Oh, I was just going to say, throughout it got better in training, actually. When I went to residency, I was in the South, East Tennessee State, and they not only focused on like ways to improve, but how good you were doing too. There was actually a lot of praise that I received from my work, and that was probably the most helpful thing because that's usually not as big of a focus when people are giving you feedback. They're always like, oh, you could do this better. Oh, you need to show up earlier and talk to this patient in a different way, right? Like there's always something to nitpick at in medicine because there's a lot of pressure. You're dealing with patient lives, right? And so I think that actually helped improve it, but it's always been there for me, even today. And, I am working at it, right? But I even feel like, I'm going to be an attending in a year, and I'm just like, wow. Yeah. How's that going to go? You know what I mean? Even though I'm
right there with
very educated, and I've done a lot of, exams, and I've done all the stuff to be where I'm at today, but you still feel that way. And I think there's just like still a lot of pressure no matter what place you're at, medical school attending, whatever it is. And there's just so much to know, right? And you never know what patient you're going to get, especially a difficult one that can make you feel that way even more. So
for definitely, I agree with that. And one of the things that helped me is talking to my colleagues about it. When you think that you're the only one in the room that feels that way, and you start opening up and being vulnerable and saying, hey, sometimes I don't feel like I belong. And then you start hearing other people tell you, I remember I heard, like, when you hear like the smartest person in the room telling you, I didn't feel I belong because I'm a female. I didn't feel I belong because I'm this or that. And then you start saying, maybe I'm not alone. Maybe this is something that all of us have to deal with at different levels and different grades. The praise thing that you mentioned was so strong because it's how we perceive things. Sometimes when you hear feedback, when we have our semi-annuals, you're sitting there, they're telling you the positives, the negatives, all of that. Sometimes your brain just hears the negative. But then you skip all that, these huge paragraphs of that medical student that said that you were amazing to them, or helped them, or that patient that left you a greeting card saying thank you for helping me that day. So it's definitely something that I guess we might have to carry, but to what extent, to what kind of degrees? There's imposter syndrome that can lead to burnout, like you were talking about, because people think that burnout is just being overworked. It's not just that. It's feeling undervalued. When you're constantly on edge, when you're tired, it leaves so little time for joy and enjoying that profession, enjoying residency, enjoying actually your successes. So you just focus on that part, do I actually belong? So that's where we have to find that division between how we feel and how we're acting.
No, that was very well
said. What do you think is the hardest part about having to approach a colleague? Because for me, it sounds so easy, right? Because we're all going through this experience, but you don't want to do it. Like, at least me, I don't want to go to my colleague and say I don't feel like I belong here.
So the interesting thing about that too is if I can say one thing, that was so important to say, like speaking to your colleagues, because I remember what I carried with me throughout my residency, thinking that like, oh, I didn't accept the praise. I only heard the negative things I could have improved on. And then the final week of residency, we had rosebuds and thorns. So everyone had to say their highs and lows. And for the first time, I heard that everyone was going through the same thing. And I kept thinking to myself, if I would have known this last year or a few months ago, my whole mindset would have changed. I would have been in a totally different place mentally as well if I just reached out to get support. So that is so important. If it can't be your colleague, somebody.
For me, it happened 2 years into residency.
It takes a while.
Where we were doing the same rotation, and I remember it was just a comment. And my colleague actually started it. She said, did you notice that when you say something, the supervisor we're attending wouldn't listen to us, but when the male colleague says it, they get praise for it. And then I turned around and it was like, I thought I was
the only one.
The only one. And it happened and when it happens once or twice or 3 times, but when it happens through a whole rotation, you feel very small. So when that person said that to me, it was a shock. Like I was like, I thought I was the only one. And I blame myself for not speaking louder. I should have said this. I should have been more assertive.
And that's hard too, especially being
the first step is always hard.
Especially being a resident as well, because you're put in so many, it's like a hierarchy. So you feel like people can speak to you any way you want and you're just supposed to take it. And you go home with those things as well. I'm not good enough, or I didn't know this, so I'm not as smart as that person either. But it's not the truth. It's the lies that you tell yourself.
And it's many moments. Not just one moment. It's that little voice in your, like, it's like when somebody mistakes you for a tech, or somebody tells you, can I talk to the attending, when is the doctor coming in, or you get passed for like something that your male colleague or counterpart that says. It's just like little moments that kind of build on, and then it becomes into whispers. Do I belong here?
Exactly. And it doesn't change when from my standpoint, it doesn't change when you're in attending. It really does. And I feel like that's when you question yourself even more, because you're in charge of everything from top to bottom, from when the patient comes in to the when the patient leaves. And if they don't like the way something goes, or they don't agree with your plan, it's
or if
the
they're
first,
not used to it.
if they're not used to it as well, the feedback that they even give you, it's like it goes straight to your mental, like every single time. It's difficult. And then at that time, it's like so important to find mentorship in like whatever field you're in. So you have someone who's been through it before from day one, can kind of reach out to you for help and guidance.
And that mentorship that you were talking about is so important. I remember when they used to ask me, who are your mentors? I had 2 or 3 mentors, and they would ask me why I had 3. I would tell them one from an academic standpoint and one from a personal standpoint.
Yes, that's the best advice.
Important.
It's really important.
And people were wondering why I chose that specific person, because I was like, when I feel I need to hear something specific, when I need to hear it,
Exactly,
to get by and get through.
Right.
So it's always about that, finding the right person, taking the right step. It can be a colleague, it can be a mentor, it can be your supervisor, it can be anyone.
Yeah.
I think there's an even bigger question here. Like, we're speaking about all of the hardships of medicine as trainees, as an attending, whatever the case is. So I guess it has me thinking, is medicine toxic? Like, is this a place where young minds who are going to serve, like, patients who are in need, people who are in need, is it healthy for us? Is it needed? Do we think not? And this is not about like our institutions generally. Is it, like, medicine, like, is there a toxic culture?
I think it can definitely be draining. And I think, that comes from internal pressures, right? Like, I've been raised in a family where, higher education is encouraged and certain grades are, preferred and all of that. Like, you've been raised that way, right? And so I think that's
you want to touch briefly on your background just so.
So my dad's also a physician, and he did his training in Europe. So he's Southeastern European. And just like culturally very high achieving and just something he wanted for all of his kids. So so the pressures from family internally, that started very young, right? So and that was carried into medicine and probably just got worse because everyone's critiquing you and evaluating you and saying to improve in these different ways. But it's also very rewarding. So I do want to give it, that respect. Like, I think that's why I chose psychiatry, because I could relate to it in some way with patients and their stories, but also like how much help I can give to the patient. And it's not going to be rewarding every day or even every week. It's going to be very draining at times. And that's when, you have to realize, okay, maybe I should start reaching out to people and seeing my therapist maybe a little more often, and hanging out with Diane and Dayna. Let's go out. So it's also recognizing like when you need that help. I think it just becomes a skill and something you need to focus on as you go through it, because it is very tough.
That's so powerful what you said, because we bring something into it as well. We bring our internal pressure with us. I came from a family of immigrants as well, and my father was a physician. He had to break barrier from a very humble background, went to Europe, finished his studying, and he was an immigrant. We were like for his whole life. So for them, because they had to go through these barriers and these kind of life, their understanding of future is excellence. It wasn't optional. It was the only way to assure a secure future, a life, and all of that. And that's how they showed their care, and by ensuring that you have the best education, the best all of that. But then it transits into that voice from, did I forget something? Should I get better? Because it helps you grow. That voice helps you grow. But when it transitions from, did I forget something, to that same question, do I belong in Hopkins? Do I belong in Georgetown? Do I belong in this place? It becomes corrosive. It becomes toxic. It eats you on the inside.
For sure.
And I'm glad we can kind of all speak from that perspective, because it's hard, because especially when you're in a family, just like we all said, where they had to fight to even come over here. I feel like they don't always understand those feelings of anxiety that you may speak to them about, or not to say. I mean, every family is different, of course, but mental health isn't always understood in that standpoint. Burnout's not always understood, because they're like, we've been doing it for years and we're fine too. So it's hard to actually find, that outlet when you come from such like high achieving or families as well.
And I think and I think the definition of burnout itself is what confuses people. People think it's very dramatic. He's not showing up to work or not doing something. It could be silence. It can be somebody who's very funny and outgoing suddenly becomes very quiet and introverted and
disconnected.
Exactly. So I think I mean, our parents came from different environments, so they might just not understand.
Exactly.
They might have gone through the same thing,
Yeah.
but they don't have a
Right.
name for it.
Yeah.
Right. They don't
Burnout, imposter syndrome,
Mhm.
and all of that as well. So
Yeah. And I think I was just going to touch on like even like coming from like Nigerian culture, West African culture, as you said, it's not something like you go to your parents and say, or even your siblings and say like,
Yeah.
I'm depressed, I'm anxious, or even saying I don't know what's going on can be incredibly hard. And like in these cultures, right?
Yeah.
yeah.
So it's like a really hard thing to do. So I'm glad we're having this conversation to let other
Mhm.
people know that they're not alone. Because it's not something we speak about typically, right?
Yeah. Do you guys think that overperformance in medicine has led to anxiety in a lot of providers as well? Like, do you think those things go hand in hand? A lot of the times I was reading online about how physicians are overperformers with low confidence and high anxiety. Do you guys think that statement is true because of what we deal with and how we're expected to be perfectionists in what we do?
I
Absolutely.
think everyone. Oh, sorry, Danica.
Mhm.
I was just gonna say, I think everyone in medicine is anxious. Whether
Yeah.
they know it for sure or not, they're anxious. But
For sure.
anxiety can present in different ways. Like some people, when they're really anxious, they can overperform. So that means they want to see more patients. They want to stay in the hospital longer to do notes. They want to like review everything with their attending. But it can also be the opposite, like someone who can't wake up in the morning, like can't stay in the room for too long, needs to take breaks a lot. It can look different, and if you're not aware of that, you may not be able to notice it. But I think everyone's anxious.
Yeah, I do.
Can you blame physicians though? We're in an environment where being vulnerable is considered a weakness.
Yeah,
Mhm.
yeah.
You
Even
have
psychiatry.
you have to be
Yeah.
confident all the time.
Exactly.
You
Yeah.
have to put this front where you
Yeah.
know everything.
Exactly.
And at the same time you're being scrutinized with medical medical records. You hear stories about like medical legal things, and you start self-doubting yourself, and then you start waking up early in the morning. Did I forget to write that part in that
Yes.
note?
Even in the
Oh,
middle of the
God.
night.
Yeah.
How many
I've been
times-
there.
Yeah.
how
Yeah.
many
Did I order
times
the medicine? Like,
how many guys have you
Yeah,
woke
exactly.
up the next morning
Exactly.
after a shift
Yeah.
and you started addending
Yeah.
Yeah.
whatever, just, oh my God, I forgot to place an order. I forgot,
Yeah.
I had somebody who told me, oh my God, I forgot a patient in the ED.
oh wow.
It was because they're like a rough call. They already
Exactly.
told the ED they're going to admit a patient, but they forgot to put in the orders and stuff
Exactly.
because it was like it was like a back-to-back call, and it's you
Exactly.
can't blame us.
You can't
Yeah.
blame me. I've even woken up in the middle of the night, even on call, to log into my computer and see what was going on because you just can't help it because it's someone's life on the line. But I think it's important that we realize, like, I was thinking about this the other day. I had a while ago, like my first year as an attending, I had a really hard day and a upsetting night, and I woke up with like puffy eyes. I was like, no one can see me like this. Like, you know what I mean? It's like one profession where, like, if a patient was in front of you and noticed that, it almost takes away from the professionalism you're supposed to have. You can't present as yourself, all the time too. You have to be
Like you can't show weakness.
yeah,
Kind of.
yeah.
You mean?
You have to be the very best version of yourself every day. Can you imagine, like, if your patients came in and saw like red eyes or like puffy eyes or any signs of tears, they're gonna look at you like, what's going on? If their mental health isn't right, why would I go to them?
Because they're looking for you.
Exactly,
Yeah.
exactly. So it's just so hard.
No,
It's hard.
It's funny. I was in the ER the other day. I had this horrible like sinus infection. You saw me recently with it, and luckily I've recovered. But I remember going into the ER, and this lady was like, "I'm sick, but you're sick." Like, wait, who needs help here? She's like, "Go home, have a rest." I was like, "Whoa, she just called me out." I honestly didn't know how to respond. I'm like,
Right.
"No, I'm good."
But there's no breaks in medicine, right?
Yeah,
gotta
there's
work
not.
when you're
You gotta-
sick, when
you
you're
gotta
tired.
go.
Yeah.
Medicine
No
doesn't
matter
allow
what.
for that.
Or then you're like, messing up with your colleague's schedule because I was on call, right? I can't just be like,
Yeah.
calling up backup all the time. Like sinus infections just happen. So, anyways, it's just part of life.
And it's not just work that we're expected to overperform. Your personality is under scrutiny as well.
Yeah.
Exactly.
You have to be the kind one. You have to be the smiling one. You have one off day, and it's not considered as a human flaw. It's taken, as something's wrong.
Exactly.
Yeah. And one thing I've learned is that some attendings will really get you in the evaluations, and they'll like pinpoint things you never
One
noticed.
thing,
Just
one day
like,
that happened.
I remember in residency, someone said, "Oh, this is intern year, by the
Yeah.
way," and someone's like, "Diane's so quiet," and I'm like, "I'm trying to figure out what's going on. I'm not like usually quiet, but everything's scrutinized."
But there's nothing wrong with that as well. Like, there's different personalities, just like you said in medicine.
Yeah.
But there's people who won't be accepting of those things that you bring to medicine as well. And that's where the imposter kind of lies there too. Like, what do I do, or how do I react, or what should I say when I'm around these people?
And I think that's what makes us overthink. It's like, okay, I think I'm doing great, but how am I actually doing? That's like some days like, oh, that was a good day. And then you look at your evaluations, you're like, it wasn't. Oh, wow. All right. So we're going to take that back.
So that's the thing, that overthinking leads to anxiety. Anxiety can lead to depression. And that's where the issues start coming from.
Exactly.
Yeah, for sure.
And for you guys, like, I don't know if you guys have been in mentorship positions as well, but we always end with giving like a piece of advice as well. Like a piece of advice you would give to someone that's experiencing burnout. And then we'll move on to a piece of advice that you would give to someone in your field. Is that okay?
Yeah.
Okay.
Sorry. Piece of advice that you would give for anyone experiencing imposter syndrome or burnout.
Okay. I mean, all of us, I guess, a lot of us experience it to different levels. Just because we carry it just because we have it doesn't mean that we have to carry it over.
Yeah. That's good. Yeah.
Awareness, talking about it, and moving from that point is, and helping other people. If you see somebody who's anxious, who's scared, who's terrified, talk to them, ask them, how are you feeling? Tell them a vulnerable story about you. That helped me when somebody opens up to me. So maybe you can help someone.
I agree with that.
I think experiencing burnout or imposter syndrome is very common. Although not much, talked about. And if you have that, that doesn't mean you're not going to make it. That doesn't mean you don't belong.
Sure. Yeah.
You're going to be fine, and it's something that I thought was going to hold me back and almost make me drop out. But, we're here to this day. We made it. And I think reaching out for help professionally is also like, do it sooner rather than later. And I remember hearing from residency, or actually it was medical school, they were like, everyone should get a therapist in training. No matter where you're at, what level of training you're at, just get a therapist. You'll learn from them. Maybe it'll benefit, maybe it won't. Just depends on, what's your fit. But it really can't hurt. And so do that when you can. Got to make time for self-care for sure. It'll come at you when you least expect it.
What you said about asking for help is such a big thing, because it doesn't come easy for some people. More than, like, for me, it was so difficult for me to ask for help. So it's realizing that it's not weakness. It's not, that's not strength when you don't ask for help. That's so important. Either by asking for therapy or self-care, telling yourself that, you need self-care. That's so important, so powerful.
And if you can identify the signs early on, that's the time where you have to take control. That's what I say. Just like you were saying, you don't want to wait on it, although it's hard to kind of come to the forefront and put everything out there. The earlier, the better. Once you seek help, things do get better.
And don't feel guilty. Like, you can be a psychiatrist and ask for help. It does not matter. I think that's like huge, because everyone thinks like psychiatrists should have it all together, right? They shouldn't have any like mental health concerns because we have the tools to like help, right? But don't feel guilty no matter what specialty. That's what I would say.
Yeah.
Okay. All right, and then our question that we want to end on for each of you, and we don't answer this question because
it's just you
on the first one. But if you could do medicine all over again, would you choose medicine?
And one piece of advice you would give to a medical student who wants to go into your specialty. Anyone can start.
Okay.
A loaded question.
For me, yes, I would do medicine over and over again. I just don't know what it is. Like, I've had moments where I didn't want to do it anymore.
Yeah.
But looking back, I think I would do the same thing again. And advice for somebody who wants to do neurology. People get to that because people, when they hear neurology, they hear, oh my God, that's so difficult, all these nerves and all these names and all this. It's like with surgery, and I'm sure with you guys, all the criteria for your diagnosis is very hard as well. It comes at different levels for different people. You're going to go there, you're going to find somebody who can recite the whole anatomy of the brain, and you're going to feel less than. It's going to come at your, like, at specific times for you. And just keep at it, and you're gonna get there when it's time.
That's good. That's so nice. I love that.
I would agree. I would do it over, even though it was medical school. I always jump to that, but it was very miserable. I think I would change things, as in like seeking out help sooner, and when I first started medical school, I went straight from undergrad, so I think I was a little even burnt out from that, maybe taking a break between college and medical school. So I would have changed things, but I would have done it again because I am very happy with where I'm at. My field makes me very satisfied. For those going into psychiatry, one of the questions I always get is like, are you scared of patients like who have like severe mental illness? How is it working on the inpatient unit? The psychopharmacology, how's that? I get so many questions, and like, does it drain you? You know, does it trigger things? I think you asked that earlier. So I think that also is important to note, like, that's why you should also have your own professional help, right? Even when you're an attending with, you know, people think you have it all together and you know everything, making sure you have someone to talk to, because even though you can provide all this help for patients, it can be a little draining, right? And it's okay if that's the case. And I think it's a very rewarding field because we do have a lot of modern medicine where you can provide like ECT and TMS, all these like neuromodulation therapies that can really help patients. And so as much as it can be a little draining at times, it's very rewarding.
Yeah, I agree with you.
And we have a lot of really good medications that can help. Not all the time. You know, there's different modalities than just medication, but it is very satisfactory in that sense. So I really enjoy it.
That's good.
Thanks, guys. We're going to wrap up this episode, but we are so happy to have you both. So
we're so happy to have you guys.
Yeah.
It was such a good conversation.
Yes.
All right. And thanks everyone for watching. Stay tuned for episode 4. Bye.
Bye.